Hello, we are group 313 and today we are presenting on the topic of gastroenteritis. I will start with a brief introduction. So Quigley and Jang define gastroenteritis as a disorder of the physiological functions of stomach, small and large intestines due to inflammation of the digestive tract. This is a highly infectious disease and is very common in low and low to middle income countries where sanitation is lacking and is responsible for 2.5 million deaths of children under 5 worldwide every year. Gastroenteritis can be caused by viral, parasitic, and bacterial pathogens. The illness can be triggered by contaminated food and water digested that contain the pathogens needed to cause gastroenteritis. The environment and person-to-person contact can also be responsible for the transmission of this pathogen if it gains access to oral routes. The main symptoms of gastroenteritis include pain within the abdominal region, vomiting, diarrhea or loose stools, dehydration, nausea, fever, and fatigue. The worst possible outcome is, if left untreated, is that the patient could suffer from severe dehydration, leading to a hospital admission, or there could be long-term complications as a result of the original acute illness, such as reactive arthritis, which is caused by a bacteria that commonly causes gastroenteritis. The best possible outcome, if left untreated, is that the gastroenteritis will resolve itself in 3 to 4 days, providing the individual stays rehydrated with water or an electrolyte solution. And it is also recommended to avoid caffeine, carbonated drinks, and limit physical activity. The most expensive evidence-based treatment would be insertion of an intravenous drip for hydration or nasogastric tube. These interventions can be required in some severe cases. 1 in 20 children are unable to rehydrate themselves naturally, so they may require hospital admission, which can be costly if there's no private health insurance or if the stay is prolonged. The least expensive evidence-based treatment is to self-administer oral rehydration, so in the form of Gastrolyte or water, just small sips. Also, you can get over-the-counter Buscopan to help ease stomach discomfort. Anything that you can do at home really to help gastroenteritis is often self-limited, and so it will tend to resolve itself after a few days. In our opinion, which approach would we recommend? That would depend on the severity. Mild to minimal symptoms should be alleviated by self-administered rehydration at home. Severe symptoms such as moderate or severe dehydration may require a hospital admission or definitely seeing a physician. And in the case of hospital admission, the administering of intravenous drip or nasogastric tube. And our best suggested health professionals to help in this treatment. For mild cases, the physician will be a first point of call to diagnose the cause and severity, and the next stop will be a pharmacist to supply the medication to help relieve the symptoms. In more severe cases, you may need to visit a microbiologist for a stool sample to aid in diagnosis, or in more severe cases, hospital emergency nurse may need to intervene with an intravenous drip or nasogastric tube to help with rehydration. Okay, and that is the end of our presentation. Thank you for listening today.
Created using Powtoon.